guys, how are you doing? This is Becca with Willing Through Life with Becca. How are you doing? Today, did you know that today is COPD Awareness Day? It falls on the third Wednesday of November, right? Yeah, the third Wednesday of November. And I want to share with you let's see, just want to give you a little information about COPD, which is something that I suffer with. It stands for chronic obstructive pulmonary disease. It's a progressive lung condition that makes breathing difficult, most often caused by long-term exposure to irritants like cigarette smoke. It is treatable, but not curable to them. We have not found, I'm not saying that it's not curable. The internet and doctors say it's not curable, but I don't believe that it's not curable. There's no such thing as an incurable disease. There's only incurable people. But it is, so it's treatable but not curable, and proper management can greatly improve quality of life. That's the one thing I know I need to work on, is eating better. And even though I get out of breath and I'm like, I need to do little light exercises and all that. So COPD is an umbrella term for emphysema and chronic bronchitis. So emphysema damage is the damage to the tiny air sacs in the lungs, reducing oxygen exchange. Chronic bronchitis is a long-term inflammation of the airways, leading to excess mucus in narrowed passages. Little mama, hold on, guys. Okay, so the symptoms are shortness of breath, especially during activity, chronic cough with mucus, clear yellow or greenish, wheezing or whistling sounds when breathing, chest tightness, fatigue and frequent lung infections, swelling in the ankles, feet, or legs, exacerbations, flare-ups, where symptoms suddenly worsen. Causes and risk factors include, main cause is long-term cigarette smoking. Other causes, secondhand smoke, workplace exposure to dust, fumes, or chemicals, indoor air pollution from cooking, heating fuels, genetic conditions like alpha-1 antitrypsin deficiency. I don't know what that is, but we can look that up. Okay, I'm gonna highlight that, copy, and we can learn that together. Risks with age, asthma history, and repeated childhood respiratory infections. Risk increases with age. Okay, that's what I meant to say. Sorry. Excuse me. I ate a pizza last night. I had like 3 or 4 pieces. Big mistake, because now I can't stop burping, and when I burp, it tastes like rotten eggs. Probably smells like it too, but I'm not gonna even try to smell it. You're good. Diagnosis. Spirometry, measure lung function and airflow obstruction. Imaging, X-ray, CT scans. Blood tests, oxygen, carbon dioxide levels, genetic testing for alpha-1 deficiency. Staging based on lung function, from mild to severe. Treatment and management. No cure, but symptoms can be managed. Now, again, even though it says there's no cure, again, there's no such thing as incurable disease. There's only incurable people. So the most important step, quit your smoking and vaping. All right. Inhaled broncholators and steroids to open airways and reduce inflammation. You can do that. Oxygen therapy for advanced cases, in case you become a lot more worse. Pulmonary rehabilitation, exercise plus education programs. vaccinations, flu, pneumonia, COVID-19 to prevent infections. In severe cases, surgery or long volume reduction procedures. Okay? Okay. Now, living with the COPD. Stay physically active within limits. See, with me, having spina bifida, being paralyzed from the waist down, being in my wheelchair, that's not the problem. The problem is with my hernia. I have a peristoma hernia. And my doctor told me that basically doing a lot of exercises and movements can cause it to grow and become worse. So I have to be careful of that. Okay. Okay, so you need to avoid irritants like smoking, pollution, strong fumes. That includes perfume. Practice infection prevention, hand washing, masks, vaccines. Now, vaccines, I don't really like them, but we're not going to get into that. Monitor for flare-ups and seek medical help promptly. Okay? Okay, this is by Harvest Health. Credible health information source. Chronic obstructive pulmonary disease, known as COPD, refers to a group of disorders that damage the lungs. These disorders make breathing increasingly difficult over time. The most common forms of COPD are chronic bronchitis and emphysema, both chronic illnesses that impair airflow in the lungs. So that's exactly what basically I have problems with. Anyways, so yeah, if you guys suffer with any of that, comment down below what do you do to help, lessen your symptoms or whatever. Oh my gosh, my room's so small. Little mama, knock it off. Anyways, so I guess wearing a lot of perfumes, you gotta be careful with fumes. Even like paint, when you're cooking and you're frying stuff, you gotta be careful that you don't, burn anything because it could hurt your lungs. Anyways, I hope you guys are having a wonderful, wonderful day. Staying safe, staying warm. It's so cold out. It's horrible. Anyways, I hope you're having a wonderful Wednesday, and that you do have a wonderful Wednesday if you're not having it yet. Yes. Yeah. This one, Little Mama. You want to see her? This is Little Mama. She's a tuxedo cat. Come here, you little shit. Come here, you little booger. Say hi. No. Don't hide your beautiful face from the camera. Show it. And be proud of it. Oh, ow. Whoop. Oh, you know what? I'm not a butt sniffer, but I'm sure that you do have a distinct smell, like all cats do. But I'm not a cat, so I'm not going to sniff it. They put their butt in the face. I'm like, yeah, go ahead and sniff. I'm not going to do that. Anyways. And then there's one on my bed. I know. I'm not supposed to allow them on my bed. Do you see all this gray hair? You know what? F it. Who cares? We're getting old. We're getting older. It's okay. Embrace it. Just take care of yourself. This is Marvin. Hi. Anyways, I hope you have a wonderful day, and God bless you. May the Lord be with your spirit. Bye-bye.